Hi, I'm Dr. Kivett in Santa Rosa, California. I'm board certified in plastic surgery and dermatology, among other fields. I had the opportunity to spend quite a bit of time with a variety of doctors in plastic surgery and orthopedic surgery, doing hand surgery, and I also had a number of fellowships in skin cancer as well as tropical dermatology with the National Institutes of Health in countries around the world. I've also worked at great length. Today, I'd like to speak with you about wounds and topical therapy, topical meaning applied to the skin. There are times when internal medications aren't necessary. And of course, I'm always looking for the cause of a wound and trying to eliminate that cause rather than just quickly writing a prescription, handing it to you, and saying good luck. I'm always making inquiry about a history so that we can figure out why is this wound in the protective outer layer of your skin present. It's just like any other physician who is going to have you tell them about a symptom, and then they're going to inquire as to why this takes place. It's the cause that's important. The treatment is certainly important, but it's the cause that, if addressed, then many times not much medicine is even needed. Now, wounds need oxygen. There is the potential for an infection burden to be overlaid on a wound. In other words, bacteria, funguses, yeast, viruses that live in wounds. That has to be eliminated. It has to be presumed to be present, has to be looked for, and things have to be done to encourage the absence of an infection burden. Patients should have a good temperature, and that will feed the oxygen into the tissues. If blood flow is bad to wherever the wound is, it won't get the oxygen. Therefore, it won't get the immune system to fight in your favor. And so these are all considerations. If you have various diseases of diabetes, if you have blocked blood vessels, if you're a smoker, all these kinds of things make a big difference to wounds. Big difference. A wound needs to be moist, not totally inundated with a heavy, thick ointment and underwater, but there has to be continuing moisture to help let the tissues go back to the way they're used to heal. And many times once they heal, that takes care of the problem. You'll see in wounds a phenomenon which I call raspberry appearances. And these little collections of, under a biopsy, blood vessel cells look just like raspberries on a raspberry. They're irregular bumps of pink that, if allowed to come up, 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 and finally the skin knows to start coming across this already laid out bed of oxygen-bearing tissue. The body's amazing what it can do if you help it do what it needs to do, and if you stop doing what you're doing to inhibit that. The exudate that comes out of a wound looks like a chicken soup, and you've seen this when you scraped your knee a little bit, and maybe it didn't bleed, maybe it did, but eventually you just notice kind of a yellow oozing that kind of crusts up. And if I were to draw blood from your arm at this moment, put it in a tube, and let it sit vertically on a shelf, within just a short period of time, you would see two things in the tube. At the bottom of the tube is a black collection, which is really just a coagulation of the red blood cells so intensely that they look black, above which is a yellow chicken soup layer. And that yellow chicken soup layer contains clotting elements, salts, making recognition that 75% of your body is 0.9% sodium chloride salt. It's proteins, and it's vitamins, and a few other hormones and chemicals. And so that serum, if it sits on top of the wound for a long time, will not help the tissues heal as well. And of course, if there's necrotic tissue, meaning dead tissue, meaning tissue that will not arise like Lazarus from the dead, that must be eliminated. And that's characterized by charcoal black, rock hard tissue. That needs to be eliminated no matter where it goes. Because if it's not, it will become a nidus or a nest or a focal point of infection for bacteria, funguses, yeasts, and viruses. And that, if possible, will get into your bloodstream. And then you will have a condition called sepsis, which is a very serious situation because not only is the wound now infected, but your blood vessels can be infected, your heart valves can get infected, your eyes, your brain, lungs, kidney, liver, etc. So that's a good thing to avoid. In addition to treating a wound, you want to protect the surrounding skin from getting too moist. There are a number of ways that you could help fix up a wound, and we'll provide a chart for your review in that regard. Wound care centers know about this, and they have their favorite things that they use. And they include hydrogels, which add moisture to a wound that has been allowed to get dry. Film dressings will hold in moisture. And there are a number of relatively low-tech solutions in that regard. There's a thin, clear plastic, sterile, sticky film that is really a skin substitute that you can put over a variety of depths of wounds that help in that regard. Tegaderm, Opsite. There's a number of them. I'm not speaking in favor of one versus the other. Colloids and calcium alginates absorb so much fluid that's over processed in a wound, and that helps the wound heal. And then certain foams will absorb also. There's also negative pressure suction dressings that can be placed on a wound. And that technology has been around a little while, but not nearly as long as some of the ages-old treatment. And what that does is a low-grade suction that's put onto in a tube into a piece of foam that sits directly on the wound in a sealed way. And it pulls bacteria away, it pulls fluids away, it allows the skin natural moisturization content. And also, in the past few years now, there's been a wash in and wash out cycling so that after the fluid is pulled away from the wound, an infusion of a temporary nature, they call dwell time, maybe a half hour in length or so, will bring antibiotic solution into an area, let it completely cover the wound, and then the suction gently pulls it back away. And this helps a great deal with wound healing and reduction of pain. So if you find you have a wound, the physicians are interested in knowing what the causes are, taking a thorough history as to what things could possibly be there. And then we'll be asking you and expecting really honest answers from you as to what it is that is giving you this vexatious problem. So if you know someone who has a problem like this, or family member, neighbor, or friend who's simply interested in the aspect of medicine that encompasses this, then please let them know. And give us a thumbs up if you like the lecture. Leave a question or a comment. And as always, if you can subscribe to this channel, that will allow us to continue to produce educational medical information such as this. Thanks for listening.